Hi everybody. I want to talk to you about an experience that my family has gone through over the last couple of weeks regarding healthcare and their deductibles. I have a family member who is intending on getting a surgery in the upcoming days, and he was working with his doctor and paid all of his bills, he thought, from his doctor's office in order to receive his surgery. Just this morning, he received another email from the surgical center saying that he owed about another $3,000 for the surgery and the expenses associated with the hospital. Now, my family member was surprised because he says, "I've already paid so much money to the doctor's office. What do I do?" So he called me up and he says, "Nikki, what do I do?" And I told him, I said, there's only a few things you can do. First, you can try to not pay the invoice and see what happens. And he says, "No, the surgical center won't let me in unless I pay them." I said, okay, so your next option, if you don't have an advocacy service to help you through the process, is to contact the surgical center and tell them what's going on. So that's exactly what he did. A short conversation with the billing person at the surgical center was able to work with my family member to come up with a solution that was going to help both of them out. See, the surgical center didn't know that he had already been charged almost $2,000 from the doctor's office. They hadn't seen that had processed through the insurance provider yet, and so they were still assuming that he needed to reach his $5,000 deductible by paying upwards of $3,000. He was happy to discuss with the surgical center that as long as he brought his receipts of payment from the doctor's office, then the surgical center would only charge him up until he reaches his deductible of $5,000. Ultimately, that's going to save my family member over $2,000 of out-of-pocket expenses. Now, I don't know about you, but I can think of a lot of different ways that $2,000 can be spent other than improper billing from the surgical center. Now, I know it's not the surgical center's fault, and I know it takes time for these things to process, but this video today is to just remind you to be conscious of the charges and be conscious of the humanity that happens whenever we are going through these procedures. Know that it takes a while, a lot of times, for the doctor's offices to file the claims, and it may be up to you, the patient, or up to your advocacy service to help cheer for you and root for you and be on your side to make sure that you're not overpaying for your insurance claims. I'm Nikki Trentacosta, president of the TANA Group, and I help startups and entrepreneurs implement employee benefit programs, and I help administer them throughout the year. If you're interested in learning about how to streamline your employee benefits program or how to get and implement an employee benefits program from scratch, I hope that you'll reach out to me for a consultation. I look forward to talking to you, and until we do speak, I hope that you stay happy, stay healthy, and of course, be sure to wash your hands. Bye.